So my name is Jason Ward. I'm a consultant in palliative medicine based at Gemma's Hospice in Leeds, and also head year 4 of the MBChB programme. And what I wanted to talk to you about was how we've helped students learn in a specialist environment. I think from the start, one of the things it's easy to forget when we come to work every day and are based in a specialist environment, how daunting it can be for students to actually come into that environment. So from a hospice point, we know that students often have quite vivid images of what the hospice is going to be like, that it's either going to be quite depressing or quite dark. So actually giving them as much information as we can before they come to placement can be really helpful. And that can be the same for a number of specialist settings. So walking onto ITU for the first time can be quite daunting for a student. So if they've got information and they know what it's going to be like, that can be really helpful. So we've got some video clips on the MEDx site so students can look at the hospice. They can do a virtual tour and see what's part of the hospice. And that's been really well received for students, so they know where they're coming. One of the other things I think students find difficult in a specialist setting is knowing what they need to learn. So they can be somewhat overwhelmed by the amount of information, the type of patients they're seeing. So what we've done is come up with some very simple objectives for students when they come to the hospice. And those vary depending on the year of the student. So using the student expectation guide, which has been really helpful for our staff to see what's expected of students at different levels. We've supplemented that with some learning objectives. So for year 1 students, that might be something quite simple as looking around the hospice, seeing the differences between a hospice and a hospital setting, and talking to a patient. As students progress to years 4 and 5, those objectives look more around clinical decision making and some of the more complex prescribing that they then might be doing as a foundation year doctor. But actually helping students see what they need to learn when they're here has really helped. What we've also found in a specialist setting, depending on how long students are with us, is the kind of things that they want out of the time on placement. So for the more junior students, and even year 3 and 4 students often like more structure to the placement. So we've got a slightly more fixed timetable with things that we expect they'll do throughout their day or their 4 days with us. Whereas our 5th year student actually likes a little bit more freedom, and actually being based on the ward with one of the junior doctors without a fixed timetable has been really helpful for them. So they've been able to shadow the junior doctor, again learning the skills that they're going to need as a working junior doctor. So the timetable's been adjusted depending on the year of the student. I think one of the things, again, we often forget in a specialist setting is the amount of generic skills that students can learn in this sort of setting. So as much as we've got objectives and things we'd like students to learn, one of the things they tell us in feedback is all the generic things that they've really appreciated learning whilst at the hospice. So some simple things like sitting with a foundation year doctor and rewriting a drug chart, so learning about medicines management is really valuable, and it's also helped the junior doctor out, and it's provided them an opportunity to get some feedback on what they've done. Other professionals have really embraced having students, even in a specialist setting, and again students have fed back that spending time with a nurse specialist, seeing what they've learned in the classroom actually in practice has been invaluable, and seeing the role of other professionals. So they may learn in the classroom again about the role of the social worker or the chaplain, but seeing that in practice has been really helpful. And again, some of the best feedback we've had has been about the interactions with other professionals. So spending time with a pharmacist, going through a drug chart, being able to chat through some drugs has been really helpful for them. And then I think the final thing we've incorporated into the student placement is some feedback for them. So we know students really value getting feedback, and sometimes that's as simple as explaining something on the ward round, or actually completing a workplace-based assessment with them, to some more formal feedback in terms of doing a case presentation, again either on a ward round or in an MDT meeting. So I think in terms of helping students learn in a specialist setting, the key things that we've found is information at the start of the placements for students to help them be familiar with the environment, some specific objectives, a clear structure to the placement depending on their year, and then opportunities for feedback and to work with other professionals whilst they're with us.